What I'm going to talk about is the pathophysiology of schizophrenia. Now, many of you have heard this presentation from me in my office. You may be a patient who's been recently diagnosed with schizophrenia, or a family member of someone who has been recently diagnosed with schizophrenia. Or you're one of my students, a medical student or a resident, or even a colleague that I did a dinner program for. I do present a lot of information in a small amount of time, and it's a lot to absorb if you're not familiar with it. And so what I decided to do is put together a YouTube presentation where I go over the things that I talk to you about in my office or in a restaurant somewhere, so that you can go back and review it. So if it made sense to you the first time I talked to you, this gives you the ability to stop and pause and rewind and allow this stuff to become yours. I want you to learn it so that you have a working understanding of schizophrenia, so that for you, schizophrenia will make sense. I confess, when I first learned about schizophrenia in medical school and even residency, I had no idea what caused it, and I didn't think anybody would ever figure out exactly what causes schizophrenia. There are many ways to get schizophrenia, it seemed. People with Alzheimer's disease in late stages develop symptoms very similar to schizophrenia. People with brain injuries, whether through viral illness or traumatic injury, can often end up with syndromes like schizophrenia. People with severe developmental disorders, severe autism, often manifest symptoms like schizophrenia, and so forth. So it appeared, at least when I was in residency, that there would never be a single common cause of schizophrenia that would apply in the majority of cases. Well, surprise, surprise, in the last 15 years, that is exactly what has happened. We now have some common pathways. And when you think about it all together, when you compare, when you examine the pathophysiology of the disease, it makes sense. And that's what I want to help you to do today, is see that this disease makes sense. And if you understand how the brain is supposed to work, if you understand the physiology, then you will have a better understanding of the pathology, and it will make sense to you. Now, why is that beneficial if you're a clinician? Well, when you're talking about schizophrenia and you don't have a clue as to what caused it and why the disease progresses like it does and why patients should take their medicine, that is transmitted to the patient in your communication that you really don't understand what you're talking about. You're not going to engender a lot of confidence if you talk like you don't understand the disease that you're trying to treat. So let's go. Let me go through and explain to you the pathophysiology of schizophrenia. Hopefully this will be the best explanation you ever heard, at least until somebody refines this a few years from now. So let's go, just dive into it. To understand schizophrenia, let's start with physiology. That works for any disease process, by the way. You need to understand how the body is supposed to work before you can appreciate the pathology. That's when things go wrong and you have disease. So how is the brain, because schizophrenia is a brain disease, how is the brain supposed to develop and work? Let me give you this picture, this video, if you will, this little clip. Imagine, in your mind, if you will, a 2.5-year-old child in the back seat of his dad's car. And the window is down, it's the middle of the summer, and they're driving to the store. And on the way to the store, Dad stops at a gas station before completing the journey. So, kids in the back seat, windows down, and already, let me explain something, by the way. Okay, when children make memories, they don't do it like I do. I'm an old man, okay? And so when I make a memory, it's soft-wired into my head. It's software, basically. A little bit of hardware changes, but mostly software. What that means is that next week, I will have very little recollection of making this video, okay? That's just the way it is. I can watch the same movie over and over again and be surprised at the ending because I'm old and I don't hardwire a lot of things unless that thing is interesting to me and it's related to something that I already know. But for the most part, it's software that allows me to make memories. Now, when you're a child, when you're developing, especially pre-adolescence, That's not how it works. You hardwire like every memory. And what I mean by hardwire is you develop connections. Memory is associative. What that means is that you associate things together that occur together. What does that mean? Okay, it's like this. You're in this car, and the fact that you're having another car ride, your brain is making associations. So the chunk of your brain that's devoted to cars, your car neurons, are connected to your mom and dad neurons because they often occur together. So car neurons are hardwired to mom and dad neurons. So you see these little tiny strings in your brain that are actually dendritic connections that connect car neurons to mom and dad neurons. As you're moving along, you pass a Happy's Pizza, and on the front lawn of Happy's Pizza, there is a big giant paper pizza and a clown pointing to the paper pizza, okay? So, in your little brain, you associate clowns and pizza with cars and mom and dad. You drive for a little ways, and your mom, who's sitting in the passenger side there, or the driver's side, doesn't matter, hands you a small bag of potato chips for your journey, and you happily accept. And what does your little brain do? It hardwires potato chips with car, mom and dad, clown, and pizza. These all get wired together. As you journey a little further, you guys stop at a gas station. Dad gets out, pumps some gas, and so you see the gas tanks, the fuel pumps. So you associate the fuel pumps. You associate the fuel pumps and the smell of gasoline with the car ride, which goes with mom and dad, and potato chips, and clowns, and pizza. So all of these things are hardwired. The pizza neurons and the clown neurons go with the car neurons and the potato chip neurons. It's all, you got wires connecting all these guys together. So you can imagine, as you go through your childhood, you connect all of these synapses. Some of them are relevant and some of them are not. Some of the associations are tight. What's a tight association? Well, the association of cars and gasoline, for example. For many people, that works. That's going to be something that you're going to experience again and again. So those are tight associations that are relevant. You're going to discover as you go through life that very often driving and clowns has very little to do with one another, okay? Driving and pizza, driving and potato chips, those are loose associations. So you're not going to have a lot of those. But guess what? Those hardwired connections are there because they occurred during this developmental window between birth and pre-adolescence. So what happens then when you reach pre-adolescence? You've got a brain full of more synapses than you actually need. Okay? How many synapses are in a human brain? Well, we do have some idea. There are approximately 100 billion neurons. Each neuron has the capacity to attach to 5,000 other neurons through synapses, or as many as up to like 20,000 synapses per neuron. That's a lot of connections. So when you are around 10 years old, you've got somewhere around a quadrillion synapses in your brain. That's 1,000 trillion synapses, okay? Now, a bunch of these synapses are garbage. Clowns and cars don't normally go together. How many people go to circuses and see clowns? Not that many, okay? So you really, that's not a thing, okay? Just like potato chips and cars shouldn't be a thing, or you've got an obesity issue. If you've got pizza and potato chips every time you get into a car, you've got other issues, but that they don't normally go together. And so there's this process called competitive elimination that takes place between early adolescence and adulthood. And adulthood is done around, from a brain perspective, around 25 years old. Okay? So competitive elimination is the process whereby you go into the brain and you chop, you prune all of those connections that have proven to be irrelevant. They don't go together. So you cut the connection between pizza and gasoline and potato chips and car rides. You get rid of those irrelevant connections and you leave the tight connections. Now, how do you know which connections to get rid of? Because You're going to get rid of half of the connections. So 500 trillion synapses are going to go bye-bye. All right? Now you want the irrelevant ones to get lost. So how does your brain know which connections to lose and which to keep? Well, it's pretty ingenious. Here we have a synapse. Here's your presynaptic nerve. Here's your postsynaptic nerve. Okay, and so let's say this is an excitatory synapse. Glutamate is your neurotransmitter, and so this guy is pumping out the glutamate, right? And then this end receives it and sends the signal onward. If you use a particular pathway a lot, you strengthen that pathway, because the more you use it, the more AMPA receptors appear on the postsynaptic terminal. AMPA is associated with intelligence and learning, okay? So the more you use a pathway, the more AMPA appears on the postsynaptic membrane. So when you go through, and the less you use a pathway, the more AMPA will go away. You have to keep using it. If you want AMPA to stay, you got to keep using that pathway. So if you want clowns to stay with pizzas, you need a lot more clown-pizza interactions. And if you don't get them, then guess what? Over time, the clown-pizza interaction has less and less and less AMPA receptors on the postsynaptic membrane. So when you go through competitive elimination, you target those neurons that are AMPA poor, and you wipe them out. You get rid of them. And so as a result, your brain becomes more efficient. So you are using your resources to maintain synaptic connections that are tight, that are valid, that have been reinforced over and over again. Okay? A lot of things you don't need at 14 that you needed at 4. Do you really need to know how to make mud pies when you're 14? No. Those synapses need to be chopped, okay? So that when you get rid of 500 trillion connections, you want to get rid of the dumb stuff and keep the relevant stuff. That's how the brain is supposed to mature. If you understand that, then you're on your way to understanding schizophrenia, okay? So important to know that. Another thing that's important to know is what your brain is for, okay? Human brain, pretty big. I mean, really big. The prefrontal cortex is bigger than any animals on the planet. And the prefrontal cortex is the part of your brain that's logical, that allows you to be human. It's responsible for planning, organization, time management, memory recall, focus of attention, mood regulation, all of those things right up here in the prefrontal cortex, all right? Now, overall, what does your brain do for you? Well, so many things. I can't list them all here because it's very complicated, but one of the primary things your brain does is that it interprets sensory information. You have 5 senses: sight, sound, touch, taste, feel, all that kind of stuff. All right, well, touch and feel are the same thing. But anyway, you got those senses, and that information comes into your brain through your sense organs. And so your brain organizes all that, and it tells you, the host, what's going on in your environment. It tells you about the smells, the sounds, the touch, the everything. It tells you where you are and what's going on in that place where you are. So that's important for your brain to give you an accurate rendition of your environment. But not only does it tell you where you are right now, it also communicates to you what to expect in the future. If I do this, then what will happen? If I go up to a stranger and pop him on the back of the head, what is the likelihood that he'll turn around and say, "Thank you, sir, give me another"? Or what is the likelihood that they will be upset, that they might retaliate? Well, guess what? This brain is a massive computer that processes in parallel at an astounding speed. It has more processors, more circuits in one brain than all of the computers on Earth put together. Because we're talking about microscopic processors, microscopic transistors throughout this organ. So then, one of the things that it tells you is what to expect from other people in social situations, what their facial expressions mean, what the tone of their voice means regarding what's going on in their minds and what their intentions are. It also tells you what to expect when you do something different. For example, you're in bed at night, you think you hear a noise downstairs. You go downstairs and you find the basement door slightly ajar and you're not sure that you left it open. So what goes through your head? Well, a number of things. You're kind of scared. And one of the things that might pop in your head because of all the movies you've seen is, hey, it might be a monster. It might be a vampire. But you know what? That thought only lasts a microsecond and it is tossed aside. Right? Why is it tossed aside? Why can't it be a vampire? Well, because your brain, it knows your past. And it knows that in all of your experiences on Earth, from birth up until now, you have never seen a vampire in anyone's basement. In fact, you've never seen a real-life vampire anywhere outside of movies and literature and TV shows. You've never seen one. You don't know anybody that's seen one. Nobody that you believe is credible. Okay? So your brain does something called Bayesian calculations. It calculates probabilities. And vampire is just not high on the probability list, so you write that off and it's not a concern. But you are concerned about a possible intruder, somebody in there to rob you, for example. And so you look around the house to see if there are any broken windows or any doors are kicked in. And that'll give you some idea as to what to expect in that basement. All right. That's what a normal brain does for you. It calculates those probabilities and it gives you some idea as to what to expect in certain situations when it is functioning well. Another thing that a well-functioning logical brain does is the higher brain controls the lower brain, or the upper brain controls the bottom brain. Again, I'm referring to the distinction between the logical aspects of your brain, the bulk of the cerebral cortex, and then the limbic brain being the lower brain. Negative stimuli is twice as potent as positive stimuli. Why is that? Why would God do something like that to us? Why would He make negative things more impressive to us than positive things? Well, survival. It's all about survival. Imagine, you're going through the woods and you see this rather large cat and you go to pet it and it turns around, roars at you, and then slashes you, all right? And you come away, you live, but now every time you see a large cat, you're going to automatically have a tendency to want to go the other way because you're not going to forget that experience. That once you've been attacked like that, you're never going to forget it. When I was a kid at my grandparents' house, I'd never seen a wild cat. I didn't know that there was such a thing as a wild cat. And a wild cat on my grandparents' farm had kittens. And I thought it would be really neat to make a pet because cats were associated with tame. All the cats that I'd seen, I was about 5 or 6 years old, and every cat I'd ever seen was tame. And so I had no experience with wildcats. So in spite of my grandmother's warning, I went out and picked up one of those kittens. And I discovered that kittens could be quite ferocious. And that cat scratched me very deeply multiple times. And I never forgot that. That was the last time I ever picked up a cat without knowing whether it was tame or not, okay? It was amazingly ferocious, and it made me think, wow, if a kitten can do that much damage, can you imagine what it would be like to pick up a grown wild cat? They could rip you to shreds, my goodness. But that experience made an indelible impression. That is for survival's sake. You want to remember that stuff so that for the rest of your life you take precautions. So negative stimuli are twice as potent at making memories as positive stimuli. And that is pretty much stored in an area of the brain called the amygdala. Now, that's a ridiculous oversimplification, it's true. But the amygdala is the repository for emotion. It is the capital of the emotional brain. And the amygdala, the emotional brain or the limbic brain, has its own nuclear reactor. What do I mean? Is it radioactive? No. What I mean is this. Your logical brain works best when it is taken care of. So you've got adequate food, you've got adequate water, you're not stressed out, you got plenty of sleep, and when all those conditions are met, your logical brain works well. And Your emotional brain, it can cry and whine and complain about all the possible threats, but the logical brain is constantly monitoring the emotional brain. And when the emotional brain wants to erupt, the logical brain does threat assessment. Threat assessment. It looks at what the emotional brain is whining about, and it immediately sums up the threat and says, you know what? You're worried about nothing. You're complaining. You're upset because there's a dead worm on the carpet. You're freaking out at a 10 out of 10. It's not worth that. The worm is no threat. It doesn't bite, and its body isn't even going to leave a mark. I can clean it up very easily. Therefore, what you're afraid of, I got this. And so it connects through the unsonate fasciculus, it connects area 25 to the amygdala directly, and the logical brain, when properly cared for and has it's fully fueled, it will bring the emotional power of the limbic brain down to a 1 or a 2 out of 10. It's doing that all the time. It is regulating mood by doing threat assessment and then actively bringing the temperature of the emotions down. Okay? That's what it's supposed to do. So, now that you understand that, let's talk about schizophrenia. In schizophrenia, the process of competitive elimination goes awry. That is the fundamental problem in schizophrenia, and for people with genetically induced schizophrenia at least. Competitive elimination is supposed to involve the loss of those synapses that are amphipolar, and you identify those, get rid of them, so you lose 500 trillion synapses that are loose and irrelevant. Now, in schizophrenia, instead of targeting amphipolar synapses, you target 500 trillion synapses, and the choice is random. And so at the end, you're left with half of your synapses. And some of those synapses are stupid. You're left for the rest of your life. Pizza and gasoline and clowns and potato chips are going together. Okay? You should have gotten rid of them, but you didn't, because you got rid of stuff that you needed and left a bunch of junk that is loose. And so this thing is not functioning properly. Schizophrenia is first and foremost a cognitive disorder because of bad competitive elimination. All right? Now, what I mean by that is this. You have a child who's, in elementary school, their grades were fine. They were a decent student. They had friends. They talked about their friends. They visited with their friends. And suddenly, they're 13, 14, 15 years old. And their grades have dropped off a cliff. They're not doing homework. They're getting horrible grades on the quizzes and the exams. And they're not talking about their friends. You don't see them playing with friends. And what's the problem? What's on your differential when you see a change of that nature? Well, first of all, you have to exclude substances, because if they started smoking weed, doing drugs, then hanging out with the wrong crowd, then that's a potential problem that can cause that. So certainly you want to rule that out. You also want to rule out that they have a girlfriend or a boyfriend, because that can certainly be very distracting, as you know. So, and you rule that out. You rule out some strange, weird thing like, satanic cults and stuff like that. So make sure that's not happening, that they're not being molested by a neighbor or anything, something along those lines. So there are some other situations you want to be aware of that can cause these kinds of changes. Now, once you've gotten rid of all the exogenous, stuff, the number one thing on your differential is now schizophrenia. Number one. Especially if there's a family history of either schizophrenia or bipolar disorder. Okay? That's very serious. That's your number one thing to be aware of. Okay? So schizophrenia is first and foremost a cognitive disturbance. Why the cognitive loss? Because of improper competitive elimination. You're getting rid of half of the connections in your brain at random. And so cognition is going down. Their ability to remember and think and learn and integrate information is whacked because they've lost all of these synapses in their head. Now, once so they haven't had any delusions, no hallucinations yet, but that's coming. And let's say now for men, for boys, the age of onset of schizophrenia is between 15 and 25. For women, it's between 25 and 35. It suggests that perhaps women, although women begin maturity earlier than men, they may finish later. That's one idea. We're not sure as to why that is, so stop asking me that question. I get this all the time. I'm not sure. We haven't figured that out yet, okay? But anyway, that's the way it is. That's significant because with boys, with males, very rarely will you see a male that graduates from graduate school or college even, because the disease hit them before their higher education kicked in. Very rarely will they be married when they have their first psychotic break. With women, it's not unusual for them to already be married, to have children even, to even be in medical school or finish with medical school, and then the disease hits. And so that changes things quite a bit. So the dynamic is quite different in women than men. But anyway, I digress. So what happens? They lose so much of this cortex, so many of these connections that they needed, that they start to fall into difficulty with reality testing. And reality testing refers to delusions and hallucinations specifically. Okay. So what's happening? Why suddenly the delusions, hallucinations, and disorganized thinking? The short answer, of course, is because of the competitive elimination gone awry, they've lost 50% of the connections up here. And as a result, the limbic brain, which, remember, it has its own nuclear power generator here. And I say that because even if the top brain does not have enough, there's not enough sugar, not enough nutrients in the diet, it's sleep deprived, this thing doesn't work very well under those conditions. The emotional brain doesn't need that stuff. It works regardless. You can be starving to death, dehydrated as anything, and your emotions are still fully operational. Okay? So with the decreased potency of the top brain because of the ravages of bad competitive elimination, the limbic brain starts to do the thinking. And the problem with thinking with your limbic brain, with your lower brain, with the amygdala, the problem with thinking with that organ is that it doesn't know how to solve anything. And so it freaks out about multiple problems and sees threats all over the place and does not have the ability to do threat assessment. And so it just reacts to the scary things in the environment. And it can generate fears that are irrational. Why the irrational fears? Because think about what the top brain does for you. It helps to not only figure out what's going on in your environment, but what to expect. And you need tight associations to accurately predict that stuff. With a bunch of loose associations, hey, you see somebody in the car and somehow clowns become a threat because you've got all these crazy associations, and the limbic brain being hyperactive makes it worse. It makes it worse. Okay? So that's where the hallucinations and delusions come in, because your perception of the outside world has been altered by deficient competitive elimination. Okay? All right. So then, why do we need to treat? We have a number of studies which demonstrate that within the first 10 years after diagnosis, if you have a lot of relapses, multiple psychotic breaks during those first 10 years, the more psychotic breaks you have, the worse your illness will be for the rest of your life. Is very likely that you will end up living in a group home or institutionalized, and you will not work, and you will not have any independence. That is what happens if you are hospitalized over and over again. It has a neurodegenerative effect on the brain. Your brain goes down, down, down. Your IQ goes down, down, down with every psychotic break. Same thing with bipolar mania. Every time you go manic, you lose IQ points, and you do not get them back. So those first 10 years are exquisitely important. Take the medicine on a regular basis. Don't stop taking the medication. If you do, the consequences are horrific. So it's very important to understand that in the treatment of schizophrenia. Okay? So hopefully you have some idea now as to what is happening in schizophrenia, and you'll be able to explain that to your patients or to your family members. And if you haven't, I hope that you use this information to help you stay on track, to be consistent with regard to taking your medicine so that your disorder is mild rather than severe. And it's up to you. It's up to you. And if it's your loved ones, you don't tell your children with schizophrenia, "Did you take your medicine? You acting crazy." Okay, that kind of stuff is condescending, and it's just going to make them not want to take their medicine. Okay, that's not how you do it. Do it. You want to encourage them with as much reason as you can. Okay, if you understand the malady and can explain to them why it's important to take the medicine, especially in that first 10 years, then maybe they'll be more compliant. We have some great medicines today. Some of our medicines are not even oral, they're injectables, and which means you don't even have to take a pill every day to remind you that you have this condition. It's like an injection once a month. One of our injections is once every 2 months, and we have one that's even once every 3 months. So not even an oral medicine to take every day. An injection that you receive 4 times a year. So, if it allows you to ultimately have some type of autonomy, this is totally worth it. Preserve your brain. Preserve your brain as much as possible. Now, are we looking at a cure anytime soon? It's possible. It's possible. The way at this point, as far as envisioning a cure, it'll probably look something like this. I mentioned you have 30 to 60 genes involved in the NMDA glutamate receptor. Okay. Did I say that already? I don't know. I might not have. Let me just say it right now if I didn't. Okay. The NMDA glutamate receptor has 4 subunits: alpha, beta, gamma, delta, and epsilon, theta, zeta, rho. I'm just making those up, but you need to understand it. And the brain swaps out, like when you're a child, you have the alpha, beta, gamma, delta subunits. As an adult, you have the adult version. And the swap takes place in different parts of the brain at different specific times. There are 30 to 50 genes that control that swapping out process of the NMDA glutamate receptor. If you have a mutation in any one of those genes, it predisposes you towards schizophrenia, because if you have a mutation in one of those genes, it causes competitive elimination to go from specifically targeting AMPA-4 receptors to random. And that's what happens in schizophrenia. You randomly knock out the glutamate receptors. Glutamatergic excitatory receptors. And so you knock out the good associations as well as the loose associations. So that's what happens there. Now, just because if you have a twin that has schizophrenia, what is the likelihood that you will have schizophrenia? It's not 100%. If this were purely a genetic disease, it would be 100%, but it's not. It's only 50%. I have patients where one has schizophrenia and the other doesn't, and they're identical twins. Now, we can kind of predict which twin will have the schizophrenia, though. Sometimes you'll see twin-twin transfusions where one twin gets most of the blood and the other one did not get a good blood supply, and so they're born with weakness on one side and a little cognitive disturbance. That will be the one that ends up with schizophrenia. Or if you have twins that are separated at birth and one is placed in a happy, well-balanced family with lots of love, and the other gets put in a family where the child is neglected. The one in the stressful situation with the neglect, that will be the one that gets schizophrenia. Or if one is injured, especially head injuries, head trauma, or exposed to neurotoxins, okay? These are things that will be the one. The distressed child, the damaged child, is the one that will probably end up with schizophrenia. So it's not just genes. There needs to be an outside stress factor that pushes you over the edge. And there are reasons for that. And I don't want to get into that now because that's another topic, and maybe I'll do another program on the long-term effects of stress in childhood. Okay, so there's that. There are things that mimic schizophrenia. I mentioned dementia. As dementia advances and you start losing the cerebral cortex through this dementing process, you end up with something called dementia-related psychosis that looks exactly like schizophrenia, okay? So I have patients, for example, I used to have a brain injury clinic and saw a lot of people who were victims of motorcycle accidents and car accidents. With brain trauma, you often end up with a syndrome like schizophrenia. With developmental disorders like autism, you sometimes see syndromes like schizophrenia. And so what this tells us is that, that competitive elimination gone awry is one way to end up losing potency of our top brain. But other things that cause cerebral cortical damage also, because you lose the functions of that cerebral cortex and your limbic brain goes off on its own, and you're left with it leaves you with syndromes like schizophrenia. So it's not just from competitive elimination, but when there is a genetic source, the competitive elimination problems are most likely your common problem. Okay, so I would strongly urge you, if you have children, please don't let them smoke marijuana. Please, if you have a family history of schizophrenia, your grandfather or a father or a brother or a sister has schizophrenia, and you have children, you need to warn your children, look, if you smoke marijuana, there is a high likelihood that it will give you schizophrenia or bipolar disorder, okay? The THC has that ability. The genes alone do not fate you to have schizophrenia. There needs to be another factor. And so you want to warn them against substance abuse because, hey, if you want to end up like grandpa, then go ahead and smoke marijuana and drink and get involved with other substances and you're on your way. You cannot afford those extra insults. I hope you found this presentation useful for those of you who are going into psychiatry, or if you're going into medicine in particular. You're going to see people with schizophrenia. It's 1.1% of the population. So they're going to be coming to you. And if you understand the malady, then you're able to hopefully communicate that to the family and the patient. And if you know what's going on and you can communicate that, then it tells the patient you know what you're doing. That's an important part of their treatment. If you just throw drugs at people and you don't know what the benefit of that drug is, then your credibility is suspect, and the likelihood of the patient being compliant with medication is lower. And again, understanding pathophysiology is so important. My goal for those of you who are going into medicine, for those of you who are going to be psychiatrists, is I want you to own this. I want you to understand schizophrenia well so that you're able to communicate the importance of treatment to your parents, to your patients. Well, your parents do if they have schizophrenia.